The following segment is paid for by Holston Medical Group.
Well, school is now back in session, and that means a new sports season as well. Statistics show each year more than 170,000 kids are treated for concussions. In tonight's Health Matters, we sit down with Dr. Emily Campbell, family and sports medicine physician with Holston Medical Group, for some valuable information for players, parents, coaches, and athletic trainers.
Fields all across our region now are filled with student athletes practicing hard, performing their best, and testing their limits.
Anytime you have a sport that has a lot of contact, you're going to, of course, immediately have more risk of concussion.
Dr. Emily Campbell, family and sports medicine physician, says concussions can happen in any sport, but football, cheerleading, and soccer come with a higher risk. She says training the athlete is important, teaching them techniques to prevent injuries.
A lot of times making sure you don't lead with the head, and that's even in soccer, making sure that you have good technique if you're going to head the ball or if you're going to have a challenge in the air, that kind of thing. And is like stunting and cheerleading is basically where you see a lot of the concussions that occur there. So of course there are skills that can be practiced.
Signs of a concussion can include headache, light and sound sensitivity, and confusion, all following some type of jarring incident to the person's head or body.
If there's a question, if there's a concern, you stop, you evaluate, and the answer might be it's fine, and then you can go back. But you need to stop as soon as you might expect or suspect in an athlete that they may be a little off. We just need to go through the general protocols that have been put in place on the sidelines in the high schools and in the colleges and even in recreational sports.
Each situation is different, and that is why Dr. Campbell says it is important to have the person assessed quickly and thoroughly.
One of the things that we have to be sure of is that they don't return too soon, because even they might be feeling better, and of course they're going to want to be out playing and back on the field, and we have to make sure that they're ready. And so there's actually a return to learn and a return to play protocol or series of steps that we have to take to get an athlete back safely.
Dr. Campbell also says they like to use the phrase, when in doubt, sit them out.
If we feel like they are safe to go back, absolutely, we want them back on the field. But if we're concerned, we sit them out until we can get them better evaluated, and then we can make better decisions after that.
To read more about concussions, please visit the Health Matters blog by going to holstonmedicalgroup.com.